On the occasion of World Heart Day, we are going to do a deep dive on the most important organ in the body, which is our heart.
You can think of the heart as the centered delivery system in your body. Most important function of the heart is to ensure a consistent and sufficient delivery of oxygen-rich blood to all the organs. The heart itself needs some blood supply.
Of course.
And this is taken through 3 or 4 small blood vessels, the sizes of about 3 to 4 millimeters, just outside the heart, back to the heart to supply the heart for its own needs.
There is a lot of confusion in 3 terms that we will be talking about. One is heart attack, then the second one is a heart failure, and the third one is cardiac arrest.
Now, the key terms here are sudden and decrease in blood supply. When this happens, the heart acutely faces a shortage of blood, and that portion of the heart can then start to malfunction, depending on how severe the reduction is and depending on how quickly it develops.
So it's very important not to stop treatment. It is very important to up titrate and optimize the therapy.
And then we tell patients that the most important thing after this is to begin chest compression.
Chest compression. So chest compression only CPR is something that people should be trained as much as possible. Welcome friends. Welcome to Prime Talks. I am Dr. Vaidya. I am the Medical Director of Horizon Group of Hospitals. Also, I am a pulmonary and critical care physician. On the occasion of World Heart Day, we are going to do a deep dive on the most important organ in the body, which is our heart. Today, our guest is Dr. Suheil Dhanse. He is an interventional cardiologist at Horizon Prime Hospital. And also, he has done his MD and DM from Manipal Institutes of Medical Sciences. Welcome, Dr.
Thank you, sir. It's a pleasure to be here in this honorable and noble sort of initiative taken by Horizon Hospitals.
Very nice. Can we start talking a little bit about the heart as an organ and how it functions and how the structure of the heart is?
Right. Yeah, perfect. So you can think of the heart as the central delivery system in your body. It is a small organ the size of your fist and typically has 4 chambers, 2 atria, 2 ventricles. The most important function of the heart is to ensure a consistent and sufficient delivery of oxygen-rich blood to all the organs. Although this is probably the most talked about function, the other less discussed function is also bringing back oxygen-depleted blood from the rest of the body and then sending it to the lungs for oxygenation.
So 2 important things you mentioned is the heart is not a very big organ. When we talk about the heart, is usually a size of a fist, own fist, or a little bit more here and there. And the most important is a muscular pump, and it pumps blood, which oxygen-rich blood, into each and every organ of the body. So it's a very vital organ with very vital functions, and at the same time, the venous blood is returning from the veins into the heart, going to the lungs, oxygenates,
and then back to the left side for outwards.
So the very important organ. And
in addition, out of all the blood that gets pumped out of the heart, it's important to remember that the heart itself needs some blood supply.
Of course.
And this is taken through 3 or 4 small blood vessels, the sizes of about 3 to 4 millimeters, just outside the heart, back to the heart to supply the heart for its own needs.
Exactly. So the heart not only has to supply the rest of the body, it has to supply itself, which is very important. We'll come to that in our discussions. So thank you. So that's a very, very important point. So now coming to, there is a lot of confusion in 3 terms that we will be talking about. One is heart attack. Then the second one is a heart failure. And the third one is cardiac arrest. So let us dissect this more for our viewers,
right,
so that they can have a better understanding of all these terms.
No, absolutely, because in the media, all these terms get used sort of interchangeably.
Exactly.
And without much clarity.
Exactly.
So it's very important to understand and be clear what they are. So let's talk about heart attacks. Like we were just discussing a moment ago, one of the heart's most important functions is to supply some blood to itself so that it can carry on functioning.
That's right.
You can equate this to the ability for one person to work. He needs to be eating his meals. So a 2 chapati meal for lunch. Now, when there is a sudden drop in this blood supply that is going to the heart itself, or sudden drop in the nutrition that the heart itself is reaching. Now, the key terms here are sudden and decrease in blood supply. When this happens, the heart acutely faces a shortage of blood, and that portion of the heart can then start to malfunction depending on how severe the reduction is and depending on how quickly it develops. This situation is usually what we in the medical community vaguely refer to as heart. Although in medically you can divide them into several different types of heart attacks, but broadly this is broad.
So essentially what you're saying is those small blood vessels that come out from the aorta, just above the heart, they get blocked
due to
whatever reason, and then the blood supply to the heart is reduced or compromised, and the heart muscle becomes problematic. That's a very simplest way to understand a heart attack.
Oh, I just need to just give you a further little bit more clarity here. It's not necessary that every blockage produces a heart attack, and that's the key thing to understand. A lot of times you can have a blockage which grows gradually, and as it grows gradually, your heart will adapt to functioning with a reduced amount of blood supply. And so it is possible to have blockages and not have any symptoms of the blockages like chest pain or breathing difficulty.
So it varies.
And this is why the speed at which this blockage or reduction in blood supply develops is equally important to just the significance.
So that's why you said sudden. It has to be
why I said that.
That's very nice. So now with regards to, you gave us a good clarity on what is a heart attack.
Good.
Now let's shift focus to heart failure.
Yes, perfect. So when you talk about the heart's ability to distribute nutrients throughout the body, there are two components involved. Like I said earlier, one component is receiving back a good amount of blood supply and be able to pump it forward. It is a collect and then push forward sort of function. Now, a heart failure can have either one of these components or both malfunction. But generally, it is different from heart attack in that this is, when we refer to heart failure, we're talking about decreased ability to supply blood to the rest of the body. While one of the causes of heart failure may be heart attack, there can be causes other than other attacks. For example, very popularly after COVID, a lot of people were having what we in the medical terminology call myocarditis. It can lead to a drop in the ability of the heart to pump out blood supply, and it did produce heart failure. A lot of it recovered, some of it goes on. Similarly, there are many other causes.
That's right. So great to hear that the heart failure is basically inadequate pumping of the heart for the most part.
For the most part, that.
And then that's what we define as a heart failure. Now we'll go a little slowly on this so that our viewers can have a good understanding. And then the last thing we get confused on, people get confused on, is heart cardiac arrest, where there is a complete cessation. So the heart stops functioning completely.
Correct.
So can you elaborate on that?
So exactly what you said. A cardiac arrest is exactly that. It's an arrest of functioning of the heart. Although the cause of cardiac arrest, there can be multiple. One can be heart attack. End-stage heart failure, for example, can result in cardiac arrest. And arrhythmia, abnormality in the electrical conducting system of the heart, can produce cardiac arrest. And many non-heart related conditions like kidney failure, where the potassium goes weak,
those also can use. So there are cardiac as well as non-cardiac causes of heart failure or of cardiac arrest, and they have to be kept in mind. So that way.
Just to clarify, because often terms like cardiac arrest get thrown around without fully understanding.
So I think for our viewers, it's important to understand that there are three types of heart problems which are common. One is a heart attack, which is the blood supply of the heart is compromised. The second one is heart failure, where the pumping of the heart is compromised. And the third one is cardiac arrest, where the heart stops pumping completely. and that's called asystole or cardiac arrest. And there are important aspects for a layman to understand about this. We'll come to that. So going on each discussion, let us focus. Let's talk about how would you, as a layman, identify a heart attack? What are the symptoms and what is to be done if you think you have a heart attack, so that it is easier for our viewers to recognize them, and if their loved ones or themselves are having problems. So can you talk a little bit about the symptoms of heart attack?
That's a very important question, sir, because heart attacks are not only increasingly common, but they are also mistakenly misdiagnosed as something else. So let's first talk about the most common symptoms of heart attack. So obviously, everybody knows that a heart attack produces chest pain. What people fail to recognize is that chest pain may not be the typical chest pain that people describe in books. It need not always be chest pain that appears on the left side of. You can get chest pain on the right side of the heart. It can be in the upper abdomen, or what we call the epigastric area. It can even be jaw pain, root pain.
So very, very important point you made, because we have had patients go to a dentist for jaw pain and it turned out to be a heart attack. So wonderful point you made there.
So in addition to chest pain, you often get symptoms of breathlessness, or this sensation of impending doom, like something really drastically is about to go wrong. But breathlessness is a less common symptom with most typical heart attacks. Although the elderly, women, and patients who have diabetes do not have these typical symptoms.
Correct.
And often we see patients present with some other symptoms like nausea and the sensation of needing to vomit. People may come with an episode of loss of consciousness or giddiness, or even a fall. Sometimes they're discovered by a loved one falling on the ground and they can't remember what happened.
So such can be various,
and most importantly, profuse sweating. An episode of sudden profuse sweating can also mean that the patient is having heart.
So to summarize what you said, that chest pain is the most common symptom, not necessarily on the left side, but can be on the left side, radiating to the arm. Sometimes these are classical, but you can have a right-sided pain, center, back, abdomen, upper abdomen. So you have to be careful that if you're having some symptom like this, which is sudden onset, then we have to think of a heart attack as a differential diagnosis.
So often what we notice is that many patients, for obvious reasons, are afraid to accept that this may be a heart attack. And some amount of this even happens on part of the caregivers, the loved ones, who want to probably find a simpler to treat solution, saying it may be acidity or it was bad food. The simplest thing to do if you have any symptom is to just get an ECG. Because if it is an obvious heart attack, an ECG will show you. But a small rider there, one ECG and one heart attack blood test, especially if done early on in the heart attack, it may not be enough. We have seen several cases. We had one a couple of weeks ago, where a 35-year-old patient have come to us with chest pain. His initial ECG, heart attack blood test, echocardiogram were all normal. But within 2 hours after admission, the ECG changed.
Right. So you have to observe those.
You have to observe this. Minimum 6 to 8 hours, but ideally over.
Then.
And
so to just summarize, the point of heart attack is, if you have any of these sudden onset symptoms for our viewers, or your loved one or you yourself are having any sudden pain, don't ignore it. Go to an emergency room, get a ECG done, get a proper opinion, talk to a cardiologist, and then take it from there. Is that right?
Absolutely.
Yeah. Now, one question that I would ask you is that, if somebody thinks that they are having a heart attack, there are some people who may have medical background or have taken care of patients. Is it okay to take an aspirin?
So
before coming to the hospital?
Yeah. So I've seen a lot of my patients have asked me about these WhatsApp forwards, which are going around saying take XX amount of aspirin and clopidogrel. The thing is, in the hands of a trained physician, that's probably what we would do.
Yeah.
So which is natural for patients to think that this may be a good idea.
Good idea.
But two things to remember. One is, if you do take a large dose of aspirin and clopidogrel, even if you are having a heart attack, it's not going to stop the heart attack. Doctors give aspirin and clopidogrel to initiate the process of treatment and to reduce the risk of long-term complications.
Right.
That does not terminate a heart attack. Okay. So the reason it's important to know that is because sometimes other symptoms like an ulcer in your stomach can also present with symptoms that feel like a heart attack.
That feels.
And in that
can be dangerous.
thinness can be.
So you don't recommend to doing self-medication, rather than that, take a proper opinion and get to a hospital, get to an emergency room. Very, very good. So I think we covered the heart attack quite well. So the next topic for our viewers, we are going to cover heart failure, which is essentially reduced pumping or abnormal pumping of the heart. So Dr. Suheil, just enlighten us more about heart failure and why is it important? And the point that I would like to give to our viewers is that it is quite common and underdiagnosed. So can you cover that?
Right. Yeah. So just a little bit of background there. So in the generation when heart attack treatment wasn't as easy, heart attack resulted either in mortality or death, or you were successfully able to treat them and they recovered without much problem if you caught it up. But in the era of advances in treating heart attacks, we're able to salvage a lot of those patients who would have previously not made it. But they have to go on to live with heart failure. So it's important to understand that alongside the rising incidence of heart attacks, heart failure incidence is going up as well. So heart failure basically is a syndrome or a collection of problems in the body where the heart is unable to deliver the right amount of blood supply or at the right pressures. Okay, so it's simple terms. It's just the inability to function adequately for the body.
So for just to simple understanding, heart is a pump and it's not pumping enough or pumping with high pressures, which results in various symptoms. So let's talk about the symptoms.
Yeah. So usually heart failure presents definitely with breathing difficulty, especially that happens on exertion.
Okay. So let me just, so difficulty in breathing or breathlessness on walking would be the most common or the top symptom that's most common. So you walk and you feel breathless.
Feel
short of breath, you have to stop and things like that.
Then classically, after stopping, after a few minutes, your breathlessness goes
up. So that's a typical symptom.
In the same way, there are some more alarming symptoms, particularly breathlessness that comes on lying down. Okay, and difficulty that happens when you go to bed at night and you wake up with the shortness of breath, especially if you feel the need to sit up with this because of the shortness of breath. This also is a marker of more serious heart failure. Along with this, you get a lot of patients who have swelling in the legs and sometimes swelling on their face as well. Also swelling in the abdomen, and they may be feeling that they're putting on weight, but actually it's a collection
of fluid. So very good point. So breathlessness on walking is one important symptom. Then when you lie down, you get breathless and you have to wake up very short of breath. That's another symptom, which I think our viewers should understand. And third symptom is the swelling of the legs. So all these three can be the symptoms of heart failure.
Absolutely. These are probably the earlier
ones. So let's focus on, if somebody has these symptoms, which is the best diagnostic test to come to a conclusion whether they have a heart failure or not.
Right. So typically, there are a range of tests we do. And it's important to realize that no one single test can diagnose or exclude it. But most often we do an echocardiogram. If there's something seriously wrong and if it's an obvious heart failure, the echocardiogram will give you an indication.
Very good.
So it is nothing but a sonography of the heart.
Absolutely.
And it just tells us about the structure of the heart's walls and whether it's pumping adequately, whether the heart is enlarged, and whether all parts of the heart are operating at normal, ideal pressures.
Very nice. So as you mentioned, echocardiography is a test which is non-invasive. There is no needles involved or no punctures or anything. No radiation. And it's very quick to do and relatively inexpensive also. So along with the ECG, and echocardiogram can pick up a lot of cardiac conditions which otherwise can be dangerous if missed.
Yes,
right?
Absolutely.
Yeah. Very, very important point that you have discussed. And so now that we know the symptoms, we know how to diagnose. For our viewers, we would like to mention that now there are very good therapies for heart failure, right?
Absolutely.
So can you cover some of them which would involve interventions, maybe some of them non-interventional?
So I think we should start with drug therapy. All patients with heart failure deserve the heart failure drug therapy, and there are usually 4 groups of drugs at a minimum. I'm not going to get into the
Let's focus on the
to understand it, that this drug therapy needs to not only just be started, it needs to be tailored. The timing of initiation of drugs is selected for each patient, and also they need to be up titrated. So you start the basic drugs, and then the doctor is going to ask you to come back in a couple of weeks with your blood pressures, your kidney function tests, and some other investigations to decide if they can go up on the dosages of these drugs.
So optimization of the medicines, the word, is extremely important in these patients for a better quality of life.
That's
So if you want a good quality of life in heart failure, you want to walk, you want to maybe even exercise, you want to do a little bit of jogging, that also is possible. We have had patients which are leading a very active lifestyle after a diagnosis of heart failure with proper therapy.
And not just that, these drugs not only improve quality of life, most importantly, they reduce mortality. They reduce the chance of death in patients with heart failure. So, and this function, actually, this property is when these drugs are continued over a long period of time.
So it's very important not to stop treatment.
Absolutely.
It is very important to up titrate and optimize the therapy. Both things will improve outcomes as well as reduce mortality. So that's very important for our viewers to know that this can be really life changing and life prolonging.
Yes,
I think so.
Well, when we talk about the interventional treatments, now there's a few sort of unrelated or things that may not make much sense to the average person. The most important one from these is what we call inserting a defibrillator. So you must have seen in the movies when somebody has a cardiac arrest, the doctors come and they put 2 paddles on the patient's chest and they deliver a shock. Now, this sort of a treatment is necessary when the heart has a dangerous rhythm abnormality. And that rhythm abnormality cannot be treated in any other way other than delivering a shock to the patient's chest. But you're not always going to be around a setup where a trained doctor is going to show up with these paddles. So what we do for patients who have heart failure and who have a high chance of having this sort of a arrhythmia is we implant a device under the skin of their chest and we put one wire into the heart. This device acts like a watchman. It just sits waiting peacefully and monitoring the heart's rhythm. If ever there is an instance where this patient's heart rhythm becomes dangerous, it's going to deliver the shock automatically internally and going to reset the heart. So this is sort of a life-saving treatment. About 10% of patients with severe heart failure, that is a pumping function of less than 30%, will die of sudden cardiac death due to a rhythm abnormality per year.
So we have to identify these patients and consider them for this. Good. Very nice. So thanks for covering heart failure very well. So now we'll talk about cardiac arrest. Cardiac arrest is a condition where the heart completely stops functioning and just cannot pump any blood out of it. So can you, Dr. Suheil, talk about how it is presents and how it can be treated?
Yeah. So in the everyday life scenario, most often you will see somebody who's lost consciousness or has passed out or has suddenly become unresponsive. Sudden unresponsiveness is usually the situation. So in this, as a layperson or somebody who just happens to be standing by, the first most important thing to do is to call for help. Call for us. In the everyday scenario, a cardiac arrest cannot be managed simply by giving chest compressions or CPR. So call for trained medical help as soon as possible. In the process of identifying if this patient really has had a cardiac arrest, we usually teach first responders or good Samaritans to tap the patient and to see if he's awake or has just fallen asleep or whether the situation has resolved spontaneously.
Feeling episode or something.
Or loss of consciousness, feeling this. So usually it starts with just tapping the patient trying to get his attention and trying to get him to respond. If that doesn't happen, immediately send for medical help. And then we tell patients that the most important thing after this is to begin chest compression.
Chest compressions.
Previously in the 90s, there was a concept of mouth to mouth. But now what science has shown us is that chest compression only CPR saves your life.
So chest compression only CPR is something that people should be trained as much as possible, and it can save lives.
And in fact, Horizon does do these trainings.
We do train that.
in the general population as well, isn't it? That's fantastic. That's a very noble issue.
So we try to train young children, school children also, teachers, so that they can, if the event comes where they have to face it, they know what to do.
Yeah.
So thank you. Now moving to the next topic, how do we go about prevention of heart problems? So that's a very extensive topic, I know that, but if you can cover some parts of it so that we can, yeah.
So to start with, I think it's important to understand that the process of blockages developing is a natural aging process in the body. Okay, so everybody, you, me, everybody, develop some amount of blockages. There are factors that will cause these blockages to develop more earlier and in greater percentage, like for example, diabetes, smoking, drinking, obesity, a sedentary lifestyle where you're not walking around much, or you have the usual 9 to 5 office job and you go home and eat and sleep. These are all factors which will cause you to develop blockages early. Having said that, even extremely fit personalities like famously Saurav Ganguly, the cricket team captain of India for a good period of time, had a heart attack a couple of years ago, if I'm not wrong. Sushmita Sen, somebody who's a very fit personality, who's a yoga instructor, who teaches the world how to be healthy, she herself needed a heart attack. So then you get to the question, if that's not sufficient, if activity is not sufficient, then how do you prevent? So what we usually look at, the way we look at is that you need to be assessing your risk factors for developing a heart attack. So that includes some non-modifiable ones like age, gender, and some partially modifiable ones like blood pressure and sugar, meaning you can't really get rid of blood pressure and diabetes, but you can bring it into control. Cholesterol, the tendency to develop cholesterol, certain factors like lifestyle-related factors are definitely completely modified. Like activity, smoking, definitely. Even one cigarette can be life-threatening.
So there are, as you pointed out, there are some things you cannot change, like your gender and your family history, your age, you cannot.
Certainly.
There are certain things you definitely can change, like your lifestyle, exercises, control of diabetes, control of hypertension, control of cholesterol, right? And absolutely one of the very dangerous things to stop doing is smoking. Immediately stop smoking. So I would encourage all my viewers to stop smoking, and also to stop any non-smoking tobacco as well, like chewable smoking products. So a very important risk factor that you can immediately improve. And that can improve the blood supply, not only the heart, but the entire body. Everything can improve.
And so also, it's important to realize that conditions like diabetes and blood pressure don't always manifest. That a lot of our patients come to us and are incidentally found to have diabetes when they have the heart attack.
So we just had a patient today who had no idea that they are having diabetes and the sugars were like 800. So very important point, that keep on checking, do your blood work regularly, see a doctor, check your blood pressure. These are very easy things to do, very reasonably priced things, not very expensive to get your blood pressure checked. But that's, I think, very important.
Yeah, it's like a sit for your health.
Absolutely.
You put in the effort,
and we are seeing that people who are doing these kind of things, preventive, are living a longer and a healthier lifestyle. And I think I would like to just mention one example is Cuba, that people there are doing a lot of preventive care and finding that the people are living more, longevity has increased tremendously as as much as even Western countries, not being a rich country. So preventive measures are very important. So that's a very important point to discuss. Amongst the people, general population, who is at risk for heart attacks, who should get tested,
Right.
And in what ways?
Right. So when we look at testing, we divide it into two types of tests. One type of test will tell you if you have a clot today, if you have a heart blockage in your blood vessels to the heart today. And the second type is to tell us whether you have a chance of developing a blockage in the future. So obviously, the two tests are for different groups of people, and sometimes you may need both. We test for people who have symptoms like chest pain, breathing difficulty, like we discussed earlier, or patients who have heart failure for any reason. These type of patients will go to probably an angiogram, which can be either invasive, where we put in a small wire up your arm towards your heart, and then we take a couple of injections there under X-ray guidance. Or they can be non-invasive, where we just put you in a CT scanner, inject some saline with some dye, and then take pictures of your chest. So the information we get from this test will tell us if today you have a blockage or not, and whether your symptoms may be related to this blockages or not. It may also help us to understand what should be the next step in the treatment of these blockages. But more often than that, we encourage people who don't have many symptoms to look at their risk factors, because truly prevention is better than
Yeah.
We should be looking at your risk factors like your lipid profile, that is your cholesterol, your sugars. The misconception with sugars is that you get a random blood sugar, and if it's normal, it's normal. You should be looking at fasting blood sugar, at least post-lunch blood sugar, and a 3-month average blood sugar. We should be getting a sense of your blood pressure. And the better readings are usually the ones you check yourself at home using a simple
Check commonly at home.
check commonly at home. We should be looking at risk factors like your family history. How many family members that are closely related to you have had heart attacks or heart disease which have needed like angioplasty or bypass surgery. We should be looking at these risk factors to then decide what should be done with you. Do you need medicines only? Do you need further testing? Do you perhaps need an angiogram or a stress test or an echocardiogram? And then so on and so forth.
So proper risk assessment has to be done, I think. Good. So that was a very good point. Now coming to a very sensitive point, sensitive discussion. There are people, especially young, as you mentioned, some celebrities who have been fit and diagnosed with a heart attack. There are people who are, for health reasons, to prolong their life, improve their quality of life, go to exercise in the gyms and marathons, and then they collapse and then they die. This is unfortunately seeing more and more often. And now, what is to be done for that, and how can we identify? Can you elaborate? What is the data on that?
Right, that's an excellent question, and something that we like to address upfront. So to start with, if you are less than 35, do not have any major risk factors, and are otherwise just looking to start getting healthy and doing minimal exercise, you're probably good without much testing. But remember, no matter what you do, don't start studying.
Sure.
If you are so overexert, don't exert beyond your ability. If, for example, you have a sedentary lifestyle and you're somebody who is finding it difficult to even climb one floor of stairs, don't go to the gym and start doing 100 kg bench presses.
So do slowly.
Start graded. Start slow. That's number one. Number two, if you have risk factors, then you should consult a doctor. So risk factors at the age of 35, your risk factors may be as simple as smoking. Or it might be that somebody in your family has had a heart attack. It may not be as obvious as somebody who has heavily uncontrolled sugars, blood pressure, is morbidly obese. You may not be into that profile, but you can still have a heart attack if you start exercising the wrong way. So consult your doctor and get a risk assessment. The second most important thing after testing prior to starting exercise is starting slow.
So
oftentimes we get carried away in the age of digital media, social media, Instagram, do one for the gram, and I want to get my biceps so that I look good on Instagram and social media. And in this process, we get carried away with the wrong kind of exercise. So to start with, you should, if you're beginning as an exerciser or you're beginning to get into the fitness journey, you should start with exercises like brisk walking, jogging, cycling, or swimming for at least 40 minutes a day. If you're doing it 5 days a week, that's 200 minutes a week.
That is more than sufficient for any person, I think, to lead a good quality life as well. I think if you can do that much regularly, I think it's wonderful.
Absolutely.
So don't overexert. Do a risk. Start slow. Do a risk assessment, and don't do any extra heroic, as you said. Yeah. So good point. And one point I would like to just make for our viewers, that when you mentioned the biceps part, that please do not consider any steroids or any external agents that are not approved for medical under medical supervision. They are not approved. Please don't do anything like that, because they can have a direct effect on the heart and can cause cardiomyopathy, which can lead to heart failure. So absolutely, we have had patients like that. So please do not use any steroids. Do natural bodybuilding if you can, and the strength training which is reasonable. Don't overexert. Don't run marathons if you are not trained to those acts. I think that would be a very, very important point. So thank you, Dr. Suheil, for that information. So the next topic that would I think you would like to mention is small changes. Can be lead to very good outcomes. Small effective changes. So can you cover on that?
Yeah, so this is what I tell everybody too, that many of my patients want a diet plan that will help them get healthy suddenly. And I absolutely detest those plans, because if you tell somebody to eat poha at 8 a.m. and upma at 10 p.m. and or give them a routine, they're going to follow it for a month begrudgingly, and they're going to give it. What's important is to make changes in your approach to diet and lifestyle, and changes that are small are usually sustainable. So making small decision-making changes, for example, plating your food. Now, most of us, I think, grew up in an India where the center of your plate was rice or chapati or roti or some carbohydrate, and then you get a small portion of vegetable. The simple switch in the quantities, increasing your vegetables on your plate to 50% of the plate, non-starchy vegetables, and reducing the amount of rice or chapati that you're eating. That simple switch is so powerful. The increased vegetable, increased fiber in the age, they increase fullness. They reduce your lethargy after your meal. They help you feel more active, and it goes a long way to your healthy. So it's a simple decision-making change. Just the portions of what you're eating. Nobody's asking you to give up rice. Nobody's telling you to give up chapati or bread. Just a small switch. Just like going for a walk every day for even 10 minutes to start with will give you the confidence to keep going more. Simple things like, if you want to add activity to your life, I often tell my patients that everybody, it says taking the stairs is healthier than taking the elevator, right? But what if you live on the 20th floor? Are you going to walk up 20 floors? Impossible. So take the elevator to the 19th floor and walk up one flight of stairs.
Right.
It's a simple
things that can add on to.
If you're going to go to the market, take your car, park 500 meters away, walk the last 500 meters. Simple. You don't have to walk all the way from your home to the shop.
So small additions will go a long way, but as long as they are persistent, they are long term, they're consistent and long term. And we talked about checking sugars and all that, and stopping smoking. We talked about. Can't emphasize more on that. So great. So now let's talk about the treatment modalities. Now, if somebody ends up having a heart attack or blockages, then I think the key to the treatment is restarting the blood supply. So can you talk about what is being done and what are the advances and things like that?
Right. So when you say blockages, we usually think of a heart attack. So I'll talk only about heart attack. I'm not going to talk about blockages that are there without heart. In a heart attack scenario, most often you will need an emergency life-saving angioplasty.
Life-saving
angioplasty.
So it's very important to get it.
Without this intervention, the risk of mortality or death is close to 40 to 50% in most heart attacks.
That's right.
Okay, risk of death within months.
So just one point I would like to make is that first it is important for our viewers to identify they are having a heart attack at home. So that they have to have this mentality that you don't want to take risk with your heart. And then once you have it, to go to a place where a quick angioplasty can be done. Possible. Yes.
Possible.
Okay. Yeah.
So angioplasty is a process. It's if done early, it's actually very quick and easy. Or we take in a small tube up your wrist or up your groin into your heart, and we open the blockage first. We clear whatever clots we can. We use a balloon to just reshape the vessel and open up the flowing part of the vessel, and then we put in a stent. A stent is nothing but a mesh which is turned into a cylinder. So a mesh cylinder which has a drug coating on top of it. This is the simplest form of an angioplasty, and it needs a cath lab. So you need to be at a hospital where a cath lab is available and there's a emergency cardiology team available to do this procedure.
So you obviously need a team to do that.
Yeah, you need a team. It's not a one-man work. It can't be done at the bedside.
Yes.
Beyond this, there are several other things that we're doing with heart attacks with angioplasties. I think if I had a relative, God forbid, who ever needed one, I would insist on using intravascular imaging when possible to make sure.
So these are the advances that have come that we are using in our hospital routine.
What we do is we try to look at the vessel from within rather than looking at it from outside by just X-ray to help us identify exactly what the vessel is like, what tools we need to do to get this patient out of that angioplasty properly, safely, and also to make sure that the long-term result is good.
So these are the new advances which have come, and we are using it on a regular basis in your practice. So that's very nice.
Some more advances worth talking about is that sometimes in a heart attack, you have severe heart failure, and you may need a pump to support the function of your heart, which definitely will help you save the. But they also do add to the cost, no doubt.
So whenever required, we do this. I've used it. It's very nice. So now let's go to the next topic, which is some myths that we need to be telling our viewers that they are important. So these are myths which are not true. So one thing is that heart attacks happen only to old people.
Yeah.
So that is already first step. So it's not. It can happen young. We have seen as young people as 25.
I've seen
21. So again, we cannot take it lightly. Age is no bar. And then the second myth is that if I am fit, and you already covered that there are some celebrities you mentioned who are obviously fit, but could be having some risk factors which are non-modifiable, like family history, which could be the reason.
And also with regard to fitness, the definition of fitness is there's no universal definition.
That's right.
So for example, I had a patient last month who was actually already had an angioplasty earlier and decided that it was a good thing to go to the gym and was working out in the gym regularly. Despite that, one long weekend, he decided that I have the day off tomorrow, so I'm going to go a little harder today. And that's it. That was enough. He had a heart attack then and there. Luckily, he rushed to us. He got to us within 2 hours. So we were able to open the blocked vessel, and we were also able to prove on MRI that he did not have any damage from this heart. So we were able to
because of early intervention and early intervention. Yeah. So the last myth is that the chest pain is the only sign of heart attack. As you mentioned, in diabetics, you can have breathlessness, fatigue as a presenting symptom, vomiting. So that's good. So I think we have covered a lot of topics, Dr. Suheil. Thank you for coming today on our program, the Prime Talks. And I hope this program has been useful. And we would love to ask you to subscribe to our channel and support us with a like button. Thank you.